Hello everyone, welcome to Regeneration Hub Pune. Have you ever had a patient with extraoral swelling near the angle of mandible? Also, intraoral swelling, tenderness, redness, erythema near the partially erupted third molar or wisdom tooth, especially mandibular third molar. If you ever have seen this case, that means probably you have managed a case of pericoronal abscess or commonly referred to as pericoronitis. So in today's video, I'll walk you through symptoms, different signs of pericoronal abscess, immediate treatment that can be done to provide relief to the patient, and more definitive treatment options. Also, we'll see a case of pericoronal abscess, the drainage of pericoronal abscess, and a later treatment of pericoronal abscess for long-term maintenance. So, let's get started. Pericoronal abscess is defined as infection of soft tissues around partially erupted tooth. It is most commonly observed in case of partially erupted mandibular third molars, although it can be associated with any other partially erupted tooth. It normally presents with features like pain, swelling, and debris under the pericoronal flap that surrounds the partially erupted tooth, known as operculum. Under the new classification of periodontal diseases, it is included under acute periodontal conditions along with other conditions like gingival abscess, periodontal abscess, and necrotizing periodontal diseases. Let's check the clinical features. Common symptoms are pain, swelling can be intraoral as well as extraoral, restricted mouth opening, bad taste, and bad breath. Common signs are localized erythema, edema, purulence, tenderness to palpation. There can be systemic involvement when there is fever and lymphadenopathy. If not treated in time, there can be presence of facial swelling, dysphagia, and dyspnea. The most common source of infection is food impaction under the operculum, where there is food lodgement under the pericoronal flap, the gap that is present between the tooth and the pericoronal flap. The flora is normally a mix, that is combination of both aerobic and anaerobic bacteria. And when the tissue is inflamed, it leads to a condition known as pericoronitis. There can be exacerbation of this pericoronitis due to mechanical trauma from opposing tooth. For example, in case of mandibular third molar pericoronal flap can get exacerbated due to pressing from the maxillary second or the third molar. And finally, it can lead to possible pericoronal abscess formation. For the management of the acute lesion, you should assess the severity of the condition. One can always start with local subgingival irrigation using different irrigants like normal saline or mouthwash, and then look after the debridement of the pericoronal abscess under the local anesthesia. One can drain the pus if localized abscess is present using different types of curettes under local anesthesia, of course. And finally, one can prescribe analgesics and warm saline rinses. Antibiotics can be prescribed if there is systemic involvement or spread of the lesion. Most commonly prescribed antibiotics are amoxicillin, normally in combination with metronidazole, since anaerobic infection is also commonly present. It is a short 3 to 5 day course. Once the symptoms resolve, one can plan for definitive treatment. If there is a possibility that the tooth can erupt, if there is a favorable eruption site, one can plan for operculectomy using different armamentarium like scalpel, electrocautery, or lasers. If not, then one can plan for extraction of the involved tooth after the acute phase settles. There can be possible spread and involvement leading up to cellulitis or Ludwig's angina. Once the drainage is done, The advice to the patient is warm saline rinse, maintain the oral hygiene, avoid trauma to the site, and return if there is swelling or fever increases. Now let's see a case of an 18-year-old female with complaint of pain and swelling with lower right side of the face and also swelling inside the oral cavity near the wisdom tooth area. During the examination, we see that there is extraoral swelling on the right side of the face, and intraoral examination showed there is inflamed pericoronal flap covering distal portion of the last molar tooth. There is erythema, purulence, and tenderness to palpation. The X-ray showed quite an interesting feature, that is horizontally impacted 8, and the pericoronal flap or the pericoronal abscess most likely associated with 4-7. Anyhow, the treatment advised was drainage of the pericoronal abscess. Before the debridement procedure, we keep the local hemostatic agent ready. In this case, Hemocol, that is topical hemostatic fiber. We take the required quantity needed enough, and we take the help of either universal or a greasy curette for curettage or debridement of the infected tissue that is present on the inside part of this pericoronal flap around the partially erupted tooth. So we debride it nicely and ensure that all the infected tissue or remaining food debris is removed. After the debridement, we can use irrigating agents like normal saline or chlorhexidine mouthwash to irrigate on distal as well as buccal area. The hemostatic collagen fiber is used for hemostatic purpose here, in this case after the debridement, and in around 3 to 5 minutes it soaks up the blood nicely and gives us a clean site. Once the site is cleaned, one can appreciate the retracted flap, and before discharging the patient, one can again use the Hemocol, and it can be kept onto the tissues and discharge the patient. Once the patient reports back, we expect the tissue to be in a healed state as seen in this particular video. Just the partial pericoronal flap is pending, and now it's time to do some active treatment. So we check the presence of pocket on distal as well as the buccal surface of 4-7, and we notice that there is presence of 5 to 7 millimeter pocket. To treat that, instead of doing a surgery, we have taken a call to do the local drug delivery in the form of periodontal plus AB that contains tetracycline fiber in these pre-sterile vial. There are 4 vials, out of which we will need only half quantity of 1 vial. So the required amount of tetracycline fiber is taken out and kept ready for the procedure of local drug delivery. Once the vial is opened and the material, that is tetracycline fiber, is kept ready. In addition, one can also use chlorhexidine or other mouthwash to clean up this site, disinfect this site on the distal as well as the buccal surface, that is in the form of subgingival irrigation. Now once that is done, the tetracycline fiber can be picked up using tissue forceps or a tweezer and kept near the site that we plan to do, and using a blunt instrument we can gently pack it inside the gingival sulcus or inside the pericoronal flap here. If needed, additional quantity of local drug delivery agent can be taken. In this case, the extra fiber can be taken and packed in, and we ensure that it is packed all around the pocket area. We can discharge the patient after packing of the entire quantity of the local drug delivery is done. I hope that today's video helped you in having a clearer picture about practical approaches in understanding and treating cases of pericoronal abscess. These are simple steps, but when done correctly, they help in reducing the complications and improve the comfort of the patient. If you would like to see more hard and soft tissue augmentation or periodontal surgical procedure related case videos or presentations, do subscribe to Regeneration Hub YouTube channel. Thank you for joining in. See you in the next session.